This could save your life. If you're over 60, there are 5 specific pains you should never ignore. Most seniors brush them off, thinking it's just aging. But what if those aches and discomforts are actually warning signs of something serious? Something that, if caught early, could save you from a major health crisis. Stick with me, because I'm about to reveal 5 critical pains that most seniors ignore until it's too late. We all expect a few aches and pains as we get older. A stiff back, sore joints. It's part of the deal, right? But not all pain is normal. Some are red flags your body is waving, trying to tell you something's wrong. And ignoring them? That could be a costly mistake. You see, the problem isn't just the pain itself, it's what it's hiding. Because these 5 pains, they're often the first signs of serious conditions like heart disease, nerve damage, or even cancer. And the worst part, by the time most seniors take them seriously, it's already too late. That's why today, I need you to pay close attention. As we go through these 5 pains, ask yourself, have you felt any of these recently? If the answer is yes, don't ignore it. Your future health could depend on it. Pain number 1. Abdominal pain that comes and goes. We all get stomach aches, right? You eat something that doesn't sit well, maybe a little gas, or just an off day. But what if the pain keeps coming back? What if it seems random, lingers longer than it should, or gets worse over time? That's when you need to pay attention, because your body could be warning you about something serious. Most people shrug off abdominal pain, assuming it's just indigestion or something they ate. But not all stomach pain is harmless. In fact, it can be one of the first signs of a serious condition, one that, if ignored, could lead to major health complications. Let's start with one of the biggest culprits, gallbladder disease. If your abdominal pain is in the upper right side, especially after eating greasy or fatty foods, that's a red flag. Many people think it's just acid reflux or an upset stomach, but gallstones can block the bile ducts, causing sharp, intense pain that comes and goes. If left untreated, it can lead to infection, inflammation, and even emergency surgery. Then there's liver problems. Your liver doesn't send out pain signals until things get really bad, which is why early signs of liver disease often go unnoticed. If your pain is in the upper right or middle of your abdomen, comes with bloating, nausea, or unexplained fatigue, your liver might be in trouble. Conditions like fatty liver disease, cirrhosis, or even liver cancer can start with mild discomfort. But by the time serious symptoms show up, it could already be too late. And here's one that far too many people overlook: colon cancer. If you're experiencing recurring stomach pain, bloating, changes in your bowel habits, or unexplained weight loss, don't brush it off. Colon cancer doesn't start with obvious symptoms, but persistent abdominal pain could be one of the first warning signs. The earlier it's caught, the better your chances of survival. But that's not all. Stomach ulcers, pancreatitis, even abdominal aortic aneurysms can all cause recurring, unexplained pain. Some of these conditions progress silently, only making themselves known when the damage is already severe. That's why ignoring persistent abdominal pain is never a good idea. So, how do you know if your stomach pain is something serious? If it keeps coming back, lasts longer than usual, gets worse over time, or is accompanied by nausea, bloating, weight loss, or changes in digestion, it's time to take it seriously. These aren't just random aches, they could be warning signs. Most people wait too long. They assume it's just gas, indigestion, or something minor. But by the time they take it seriously, the damage is already done. Don't let that be you. If your stomach pain is trying to tell you something, listen. Because when it comes to your health, waiting is not an option. Pain number 2. Chest pain or discomfort. Chest pain is one of the biggest red flags your body can send you, yet many seniors dismiss it often with tragic consequences. When we think of a heart attack, we imagine the dramatic movie scene, someone clutching their chest in agony, gasping for air. But in real life, heart-related chest pain can be much more subtle. Sometimes it's not pain at all, it's just a mild pressure, tightness, or an uncomfortable squeezing sensation. You might feel it in your chest, yes, but it can also show up in unexpected places: your jaw, shoulders, back, or left arm. That's why many people mistake it for heartburn, muscle strain, or even anxiety. But here's the truth. Any unexplained chest discomfort should never be ignored. Even mild chest pain can signal serious heart problems, including angina, which is reduced blood flow to the heart, often triggered by exertion or stress. If ignored, it can lead to a full-blown heart attack. It could also be a heart attack itself, not always dramatic. Some heart attacks happen slowly, with warning signs hours or even days before the worst occurs. Another possibility is an aortic dissection, a rare but life-threatening condition where the large artery from the heart tears. It can mimic normal back or chest pain. A pulmonary embolism, which is a blood clot in the lungs, can also cause chest pain. If the discomfort comes with shortness of breath, dizziness, or coughing up blood, get help immediately. Many older adults assume that if the pain is not severe, it's not serious. They tell themselves, "It's just gas. It's probably my acid reflux acting up. I don't want to overreact and bother anyone. I'll wait and see if it goes away." Here's the problem. Waiting can cost you your life. Studies show that 50% of people who die from heart attacks never make it to the hospital because they ignored the early symptoms. The difference between life and death is often how quickly you get medical attention. The key warning signs that it's more than just heartburn include discomfort that lasts more than a few minutes or comes and goes, pain that gets worse when you exert yourself and eases when you rest, symptoms accompanied by nausea, sweating, shortness of breath, or dizziness, or an unusual sense of doom or anxiety for no apparent reason. Even if you think it's something minor, get checked out anyway. It's always better to hear "it's nothing" than to ignore it and suffer a life-threatening emergency. If you experience chest pain, stop what you're doing. Sit down, stay calm, and pay attention to your symptoms. Call for help immediately if you suspect it's heart-related. Don't try to tough it out. Pain number 3. Sudden, unexplained back pain. Aching back, that's normal, right? You sleep in the wrong position, sit too long, or lift something the wrong way, and boom, you feel it the next day. But what if your back pain comes out of nowhere? What if it's sudden, severe, and doesn't go away? That's when you need to pay attention, because your body might be warning you about something serious. Here's the problem. Most seniors ignore sudden back pain because they assume it's just part of aging. But not all back pain is created equal. If yours is sharp, intense, or radiates to other areas, especially if there's no clear reason for it, you could be dealing with a hidden health emergency, one that needs immediate medical attention. Let's talk about aortic aneurysms. Ever heard of them? Probably not, because they don't usually give you a warning until it's almost too late. This happens when a major artery near your spine starts to bulge and weaken. You won't feel a thing until it suddenly ruptures, and when that happens, the pain is excruciating. It's often described as a deep, tearing pain in the back or lower abdomen. And here's the scariest part. By the time most people realize what's happening, it's already an emergency. If you ever feel sudden, intense back pain that feels like something is ripping inside you, don't wait. Call for help immediately. But that's not the only thing that could be hiding behind your back pain. Your kidneys could be the real issue. If you feel sharp pain on one side of your lower back that comes in waves or moves toward your lower stomach, it might not be your back at all. It could be your kidneys crying for help. Kidney infections, kidney stones, or even kidney failure can all start silently, with back pain as the first warning sign. If your pain comes with a fever, nausea, or difficulty urinating, it's time to see a doctor right away. And let's not forget spinal fractures. You don't need to fall or get injured to fracture a bone in your back. Osteoporosis makes bones weaker, and for many seniors, something as simple as bending over too quickly can cause a small fracture in the spine. The pain might start mild, but it can quickly escalate, making it hard to stand, walk, or even breathe deeply. And if it's not treated, it can lead to permanent damage. So here's the big question. How do you know if your back pain is serious? If it hits you suddenly, if it's severe and doesn't go away, if it gets worse when you lie down, or if it's accompanied by dizziness, fever, or trouble urinating, that's your sign. Don't ignore it. Most people wait too long. They hope it will go away on its own. But by the time they realize something is seriously wrong, the damage is already done. Don't be that person. If something feels off, listen to your body. Because when it comes to sudden back pain, waiting is not an option. Pain number 4. Persistent leg pain or cramping. Think your aching legs are just a part of getting older? Think again. Sure, a little soreness after a long day isn't unusual, but what if the pain doesn't go away? What if your legs cramp up, swell, or feel tight for no clear reason, especially when you're walking? That's when you need to stop and pay attention. Most seniors ignore persistent leg pain, assuming it's just stiffness, dehydration, or normal aging. But here's the truth. It could be a serious warning sign that your circulation is in trouble. And if you ignore it, you could be putting yourself at risk for something far worse. Let's talk about one of the biggest hidden dangers, deep vein thrombosis or DVT. Ever heard of it? Many people haven't, until it's too late. DVT happens when a blood clot forms deep inside your leg. At first, you might feel a dull ache, a cramp that won't go away, or notice that one leg looks slightly more swollen than the other. It's easy to brush off. But here's where it gets dangerous. If that clot breaks loose, it can travel to your lungs, block blood flow, and cause a deadly pulmonary embolism. That's why DVT is one of the most dangerous conditions most people don't even realize they have. And here's the scary part. DVT doesn't always come with obvious warning signs. Some people just feel a little tightness, a little warmth, or see a slight color change in one leg. But that's all it takes. If you notice swelling in just one leg, a warm or reddish patch of skin, or persistent cramping that doesn't ease up, do not ignore it. Get checked out immediately. But DVT isn't the only problem that could be behind your leg pain. Poor circulation, also known as peripheral artery disease, PAD, is another silent killer. It happens when your arteries get clogged with plaque, making it harder for blood to reach your legs. The result? Pain, cramping, and weakness, especially when you're walking. Many people think they're just out of shape when their legs start hurting on short walks, but if the pain stops when you rest and comes back when you move, that's a huge red flag. That's called claudication, and it's a warning sign that your arteries aren't working the way they should. Left untreated, PAD can lead to amputations and even heart attacks. And then there's nerve damage. If your legs burn, tingle, or feel numb, especially at night or after sitting for long periods, you might be dealing with neuropathy, a condition often linked to diabetes. Many people ignore it until it gets worse, but by then, the damage is already done. Ignoring nerve damage can lead to serious infections, foot ulcers that won't heal, and even permanent disability. So here's the big question. How do you know if your leg pain is something serious? If it's persistent, gets worse when you walk, is accompanied by swelling, skin discoloration, or feels unusually warm, don't brush it off. This isn't just about discomfort. It could be a life-threatening condition trying to get your attention. Most people wait too long. They assume it's just normal aging. They think, I'll deal with it later. But by the time they take it seriously, the damage is already done. Pain number 5. Frequent, unexplained headaches. A headache every now and then? No big deal, right? Maybe you didn't sleep well, you skipped a meal, or you're just a little dehydrated. But what if your headaches start happening more often? What if they feel different, sharper, longer, more intense? What if they come with dizziness, nausea, or blurry vision? That's when you need to stop ignoring it and pay attention. Most people brush off headaches thinking they'll just go away. But here's what no one tells you. Persistent, unexplained headaches can be a serious warning sign. And waiting too long to take them seriously? That's a mistake you can't afford to make. Let's talk about one of the biggest culprits, high blood pressure. You've probably heard that hypertension is a silent killer because most people don't even know they have it until it's too late. But one of the few warning signs it does give is frequent, unexplained headaches. If your headache feels like a tight band around your head, gets worse when you move, or comes with lightheadedness, you might have dangerously high blood pressure. And if you ignore it, you could be one step away from a stroke or heart attack. But that's not the only danger. Ever heard of a brain aneurysm? It's a ticking time bomb in your head that you don't even know is there, until it ruptures. When it does, the first symptom is a sudden, explosive headache. So intense, some people call it the worst headache of their life. If your headache comes out of nowhere, feels unbearable, or is accompanied by neck stiffness, nausea, or confusion, do not wait it out. This is an emergency. Get help immediately. And then there's stroke. Many people think strokes only cause numbness or slurred speech, but the truth is, a headache can be the first sign. If your headache comes with dizziness, trouble speaking, blurred vision, or weakness on one side of your body, don't ignore it. Time is everything. The faster you act, the better your chances of recovery. And let's not forget nerve damage, migraines, and other neurological issues. If your headaches are happening more often, lasting longer, or feeling different than usual, your brain is trying to tell you something. Don't wait until it's too late to listen. So here's the big question. How do you know if your headache is serious? If it's happening more often, lasting longer, feeling more intense, or coming with dizziness, nausea, vision problems, confusion, or weakness, that's your sign. These are warning signals your body is giving you, and if you ignore them, you could be risking your life. Most people wait too long. They assume it's just stress, dehydration, or normal aging. But by the time they realize something is wrong, the damage is already done. Don't let that be you. If your headaches are trying to tell you something, listen, because when it comes to your brain and your health, waiting is not an option. Here's the bottom line. Your body speaks to you. The question is, are you listening? Pain isn't always just pain. It's often a warning signal for something deeper, and if you wait too long to take it seriously, you might regret it. If you've experienced any of these 5 pains, don't brush it off. Talk to your doctor. Get it checked. Because the earlier you catch a problem, the better your chances of fixing it before it's too late. If you found this helpful, don't keep it to yourself. Share it with a friend or loved one who needs to hear this. It could save their life. And if you want to stay ahead of your health, hit that subscribe button because we're bringing you more life-saving tips just like this. Stay safe, stay aware, and we'll see you in the next video.